First is if they ask you to be in a fasted state, show up to the hospital in a fasted state, or they may not be able to do your scan for you. Second thing is do not wear any jewelry or magnetic lashes. Any metals will not work with the CT machine. And then they may ask you to change into a hospital gown, especially if you've got bras that have little metals on them, or any of your clothes have metals like zippers, etc. So bring a plastic bag so that you can take those everywhere with you, because the hospital may or may not provide these a place to store it or a place, something to carry it in. Third is they may give you this drink. It's 2 glasses, gigantic glasses of barium sulfate. You can do a search on it online about what it does. Really depends on what the hospital or the doctor has ordered for you. But for me, I had to drink this. It takes 40 minutes. You're not allowed to chug it because your body needs to absorb it. And I give myself 20 minutes per glass. The only problem is this is the most disgusting drink I have ever tasted. It tastes like raw sewage. They used to flavor it with Tang. The hospital stopped doing that. So now I bring my own Crystal Light or Mio. I'll put some pictures up above me so that you can see what to bring. Just be prepared. Even if you don't think you're going to need it, just bring it along. Who knows? You really don't want to put yourself through that. I almost threw up every time. And then this drink might even cause you to have a very loose bowel movement while you're at the hospital, so be aware of that as well. And then if you're required to do an IV contrast, the nurse or tech will go over any of the side effects. But what I experienced is that you actually feel warm down there, like you've peed yourself. Don't worry, you didn't do that. The CT machine, the MRI machine are very different, although they look very similar. In the MRI machine, I had to wear headsets. You don't need to do that with a CT scan. Again, it depends on your hospital. They've never given it to me, and you just hear the overhead instructions. And it's literally breathe, don't breathe, breathe, and then it's done. It's very quick. This is your first time doing a CT scan, especially for a breast cancer diagnosis. Try to bring a support person with you, because can be a really lonely experience. You don't need someone there to jot down notes or information. It's more about having someone there to be with you emotionally, because it's new, it's foreign, it's scary. Just not the actual experience, just the thoughts that go through your head that first time. The CT scan is done. They will remove the IV. You're going to have to sit there for 5 minutes, make sure that have a negative reaction to the contrast, and then you're free to go. Once you get home, make sure you drink a ton of water just to get that contrast and that drink out of your system. Thanks.